Good afternoon, everyone. Thank you for joining us for today's briefing, as usual. Today, I'm going to focus quite a lot on the paper we've just published about how we might, at the right time and in the right way, begin to restore some normality to our lives while still containing the COVID-19 virus. But before I do that, I will start, as usual, with an update on some of the key statistics in relation to the virus in Scotland. As at 9 o'clock this morning, there have been 9,409 positive cases confirmed, which is an increase of 371 from yesterday. A total of 1,748 confirmed or suspected COVID-19 patients are in hospital, and that is a decrease of 28 from yesterday. And a total of 148 people last night were in intensive care with confirmed or suspected cases of the virus, and that is a decrease of 7 since yesterday. Let me say again, as I did yesterday, these figures on hospital admissions and admissions into intensive care are very encouraging and do give us real optimism at this stage. However, in the last 24 hours, I'm very sorry to have to report that 58 deaths have been registered of patients who had been confirmed through a test as having the virus, and that takes the total number of deaths in Scotland under that measurement to 1,120. Once again, it's really important for all of us to remember that each of these deaths represents a unique, loved and irreplaceable individual, and I want again to extend my deepest condolences to everyone who has lost a loved one. I also want again to thank all of our health and care workers right across the country. This evening, many thousands of us will yet again applaud your efforts. We are all so deeply grateful to you for the extraordinary work you are doing. So let me turn now to the paper we have published just a few moments ago about the decisions we will need to take as we seek to contain this virus while also restoring a semblance of normality to our lives. And I want to be very clear with you at the outset. What we're publishing at this stage today is by necessity a first cut. I'm seeking today really to start a grown-up conversation with you, the public. The decisions that lie ahead of us, of all of us, are really complex. We will, as we have done all along, seek to inform those decisions with the best scientific advice possible. But the science will never be exact, so we will also require to make very careful judgments. And we are in uncharted territory. It's impossible to know with absolute certainty what the impact of our decisions will be in advance. That means we must also be prepared to adapt and change course as we go. We want to ease restrictions, of course we do, but we cannot absolutely rule out having to reapply some of them in future should we have evidence that the virus is again running out of control. And I want to be frank with you every single step of the way about all of these complexities and uncertainties. So while today's paper is still quite high level, it is the start of a process. It sets out the objectives and the principles that will guide us, the different factors that we will need to take into account, the framework in which we will take decisions, and the preparations we need to make now. In the days and the weeks ahead, evidence, data and modelling will allow us to take firmer decisions. As that happens, this paper will evolve into a detailed plan with metrics, actions, milestones and measurements attached to it. And I give an assurance today that as we go through this process, we will share our thinking on an ongoing iterative basis. But let me briefly set out some of the key points today. Firstly, and this is an obvious point, this virus causes real harm, and we see that every day in the statistics that we report, especially in the numbers of people who have died. But the lockdown measures we are taking to contain the virus are also doing damage. They're doing harm to the economy and to living standards, to children's education, to other aspects of our physical health and to mental health and well-being. And the toll of all of that may also, in time, be measured in poorer health outcomes and lives lost. So we must try to find a better balance than the one we have right now. But my second point is that as we do so, we cannot and we must not take our eye off the need to suppress the virus and minimise the damage that it does. And let me be very clear about this. Continuing to suppress COVID-19 is the central objective that we set out in this paper today. Obviously, we cannot guarantee that no one will get this virus in future, far from it. But an assumption that it is somehow safe to allow a certain proportion or a certain section of the population to get the virus is not part of the approach that we will be taking. Third, we're increasingly confident that measures we are taking now are suppressing the virus. The key factor, and you may have heard this before, is what is known as the reproduction rate, the R number, and that needs to be as far below 1 as possible. Now, before lockdown, that R number was very likely above 3, and that means everyone with the virus was infecting 3 more people, each of them was infecting 3 more people, and so on and on. That is what is exponential growth. Our best estimate now is that the R number is somewhere between 0.6 and 1, though I should say it is probably still higher in certain settings, such as care homes. But we can't yet be absolutely sure about any of that. That's why we need more time to monitor the statistics we report every day, like case numbers, hospital and ICU admissions, and numbers of deaths. And we need to develop further our data through ongoing surveillance. It's only when we are sure that the virus is under control that we can even start to ease any of the restrictions. And it's my next point, really, that takes us to the hard part. When we do reach that stage, the virus will be under control only because of the severity of the restrictions we're all living with just now. But the virus will not have gone away. So as we start to lift the restrictions, the real risk, and it is a very real risk, is that COVID-19 runs rampant again. So a return to normal as we knew it is not on the cards in the near future, and it is really important that I am upfront with you right now about that. What we will be seeking to do is find a new normal, a way of living alongside this virus, but in a form that keeps it under control and stops it taking the toll that we know it can do. Social distancing and limiting our contacts with others will be a fact of life for a long time to come, certainly until treatments and ultimately a vaccine offer different solutions. So that means possibly for the rest of this year and maybe even beyond. And that's why talk of lifting the lockdown as if it's a flick of a switch moment is misguided. Our steps, when we take them, will need to be careful, gradual, incremental, and probably quite small to start with. We will need to assess them in advance and monitor them in action. Sometimes, as I said a moment ago, we may even need to reverse things. As we go, we will apply our judgment to the best scientific advice possible. We will continue to collaborate closely with the other governments across the UK, and we will learn from international experience. The fact is that different countries are at different stages of this pandemic, but none of us are anywhere near through it yet, and we all face the same challenges. So as we make these decisions here, careful balances will have to be struck. For example, it may be that certain businesses in certain sectors can reopen, but only if they can change how they work to keep employees and customers 2 metres distant from each other. Similarly, with schools, classrooms may have to be redesigned to allow social distancing, so maybe not all children can go back to or be at school at the same times. Some limited outdoor activity might be able to restart earlier than indoor activity, but let me be clear, big gatherings and events are likely to be off for some months to come. We will also consider whether different approaches would make sense for different areas, though our preference, not least for ease of understanding, will be for as much consistency as possible. And of course, given how severely this virus is affecting older people and those with other health vulnerabilities, some form of shielding will almost certainly be required for the foreseeable future. Now, let me stress that what I've just set out there are not firm decisions, but they do illustrate the kind of options that we will be assessing. And as we do so, we will consider not just the health imperatives, but also issues of practicality, sustainability, fairness and equity, ethics and human rights. And lastly, as well as changes to how we live, we will use public health interventions and technology to the maximum possible to help us control this virus. In the next phase, extensive testing, tracing of the contacts of those who test positive, and isolation of symptomatic people to break the chain of transmission will be a central part of the approach that we take. And the preparations to make that possible are already underway. We will also discuss with the UK Government, for this is a reserved responsibility, the need for stronger surveillance measures for those coming into the country from elsewhere. So in short, this paper sets out the difficult decisions we face and the way in which we will go about preparing for them, making them, and also assessing their impact. I want to stress again, because it's important that I am frank, the path ahead is not an easy one. It is paved with complexity and uncertainty. But with openness and transparency and frankness along the way, I believe that together we will be able to navigate it. It is for me and for government to work through and lead that process. But this is about all of us, hence this discussion that we are opening up with all of you today. The paper we have published is available on the Scottish Government website. I will post a link to it on Twitter later this afternoon. So please, even if, like I suspect most of the population, you're not in the habit of reading government documents, have a look at it. And if you have views on it, please let us know. These views are important and will be helpful. As I said earlier, I will continue to share our thinking with you as it develops. But let me now end on a vital point, and one that you have become used to hearing me make each day. Moving on from where we are now, as all of us want to do as quickly as it is safe to do, will only be possible if and when we do get this virus properly under control. And that means sticking with the current rules that are in place right now. Stay at home except for essential purposes. Stay 2 metres apart from others when you have to be out. Do not meet up with people from other households, and isolate completely if you or anyone in your household has symptoms. This is tough. This is the toughest set of circumstances that the vast majority of us have ever lived through. And I can't stand here and promise you that it is going to get a whole lot easier soon. But as I hope we have started to set out today, if we keep doing the right things, and if we consider all of the options carefully and with the right objectives in mind, I do believe there will be a way through, and we will find that way through. So thank you for all you're doing to help. And please, if you can, engage with this discussion as we go through the days and the weeks to come. Thank you very much for your patience right now in letting me go through that in a little bit of detail. I'm going to hand over briefly to the Interim CMO, Dr Gregor Smith, and then the Health Secretary, before, of course, we open to questions from journalists. Gregor.
Thank you, First Minister. I want to say a bit today about the Chief Medical Officer's Advisory Group. From the outset of our response to COVID-19, it's been clear that we need to be guided by the best scientific and clinical evidence at all times. We've spoken on numerous occasions here about the fact that there was much to be discovered about this new virus and the disease, COVID-19, that it caused. And this means not only learning about it using the best advice available to us in this country, but learning through our broad scientific and research networks as part of a global response. That's why we established an independent advisory group to ensure any evidence considered at a UK or international level was relevant in a Scottish context. The group contains a strong mix of epidemiologists, public health experts, behavioural scientists, and leading academics from a range of Scottish sectors. That way, I'm able to ensure Scottish ministers are afforded the best scientific and clinical advice available. The distinguished chair of the group, Professor Andrew Morris, is a member of the UK Scientific Advisory Group, SAGE, to ensure that we are supporting efforts across the whole UK to bring the best science to bear in this crisis. That relationship is important, and it's one built on the principle of reciprocity, so that information and knowledge is shared freely between these two groups to each other's mutual benefit. But we also need to understand how the virus affects Scotland. That's why we've drawn together experts who can consider distinctive Scottish circumstances, including our geography, demography, and our distinct health and social care services. The advisory group have already considered a number of issues, including testing, and will continue to be instrumental in providing ministers with advice on any future proposals to ease or further impose restrictions in accordance with the framework that the First Minister has published today. I am conscious that we are all in uncharted territory here. That's why it's critical that we continue to use the best science and most robust evidence in helping us make the right decisions for Scotland at this time.
And Health Secretary.
Thank you, First Minister, and good afternoon. The First Minister has already outlined key points about the Scottish Government's approach to coming out of this lockdown phase. That will, of course, have significant implications for our health and care services. The work that we are currently doing to increase our testing capacity will become even more important, and our shift to a significant test, trace and isolate approach will be critical to our work. We'll also need to continue our ongoing work to stop transmission in particular settings, including hospitals and care homes. For example, we may well need to adapt our buildings and practices to limit its spread, and we will continue work on the supply and distribution of PPE. As we go through that work and that thinking, we will of course continue to keep you informed, but also to involve our Royal Colleges, our unions working in health and social care, our clinicians and our staff working to deliver these services. During the lockdown period, we've seen a rising number of COVID-19 cases, and our health and care workers have performed superbly in incredibly challenging circumstances, and we continue to ask them to do that, and they continue to have my heartfelt thanks for doing so. Making the transition out of lockdown in whatever way and at whatever pace is determined will continue to present challenges as we work to stop isolated cases becoming outbreaks and outbreaks becoming epidemics. I am determined to make sure that our health and care services have the support they need, the engagement that I need from them, especially in relation to testing and PPE, so that together we can meet those challenges that lie ahead.
Thank you very much. I'll now move straight to questions. We've got a particularly long list of questions today, so I'll go firstly to Laura Kunsberg from BBC.
Minister, you've said today it's only right you treat people like grown-ups. Do you think the government in Westminster risks treating the public like children if they don't share their thinking in the way that you have today?
I think all of us have a responsibility, and actually I think all of us have a desire to be as open as we can be with the public. I can only speak for myself and my own government, and I'm very keen that at every stage of the process, that's exactly what we do. And today, as I have emphasised in my opening remarks, this is the start of a process, the start of a conversation. There is a lot more detail lies ahead of us. These are horrendously difficult decisions for all governments, not just across the UK, but all governments across the world. There are no absolute rights and wrongs in this. We're all trying to navigate our way through uncharted territory, balancing the different harms that the population is suffering right now, the direct harms from the virus, the economic harms, the harms of other parts of our health service not operating as normal. So we have to find a way through this. And my last point on this, which is why I think openness, frankness, transparency, that grown-up conversation I talk about is so important, is that this is not abstract. It affects the lives of each and every single one of us. And as I've said today, it may affect our lives in different ways for quite some time to come. This lifting of the lockdown is not a flick of the switch moment. It's not binary. What we are talking about over the next months will be variations of what we're living with right now. And it is incumbent on all of us to try to involve the public in that as much as possible. That is what the Scottish Government will do at every step of the way. And I believe that is what other governments will seek to do as well. And I would encourage governments everywhere to do that. James Matthews from Sky.
Thanks very much, First Minister. You've put test, trace and isolate at the heart of your strategy today. Can you tell me, I don't want an exact figure, but there'll be a figure where you need to get to in terms of testing. Where are you roughly at the moment? Can you give me a rough percentage?
In terms of where we are, I can tell you right now, we did 2,000 tests yesterday. We're working towards a capacity of 3,500 by the end of April. I think we'll be beyond that in capacity. What we're doing right now is making sure that we are ensuring that the use of that testing capacity meets the capacity that is there. That's the here and now. In terms of moving into that new phase, that is on a much bigger scale, and that work is underway. We are working through what those figures will look like right now, so I'm not going to give you definitive answers because we've not got to that stage, and some of that depends on assumptions that are made about what the prevalence of the virus will be, how many people are likely to be symptomatic at any one time. That will very much inform what testing capacity you need. What degree of social distancing remains in place will then influence how many contacts each symptomatic person is likely to have had. That then influences the number of contact tracers you need. So that's the kind of iterative process that we're going through right now in order that we can be confident that we are building a capacity that is commensurate to the scale of the task that we need to do. I think we set out in the document today that we will set out further detail of that work, where it has got to and where it needs to get to as soon as we can, and that will be part of the open discussion that we're seeking to have with people. Gary Gibbon from Channel 4 News.
Of the population, do you mean segmenting just the shielded, or maybe different age demographics, say the under 30s, the under 40s? Could it be different? Do you rule out the idea it could be different for different sections below the sort of under 70s and the under 80s? And can I also ask, do you now think it was a wrong call for all the nations of the United Kingdom to stop track and trace? And do you really think it can be got back up to necessary speed in about 3 weeks, as some people are speculating?
Let me take those questions in turn, if I may. In terms of the question about segmenting the population, we haven't taken firm final decisions yet. So these are all things that are under review. In that sense, I guess, as a statement of fact, I'm not going to stand here and rule anything categorically out, because that would not be in keeping with the process we are undergoing. But we do know that older people in particular are vulnerable to this virus and to becoming seriously ill and dying. That's manifesting itself very severely in care homes right now, but it's not simply a question of care homes. I think possibly around 9 out of 10 of people have died. If you look at the National Records of Scotland statistics, are over 65. So clearly older people, people with other health conditions are a particular concern. There is still, I think, inconclusive debate about how children are affected by this, but that takes you to the other end of the age spectrum and what we can safely do around schools. So I guess those are the elements of the population that are to the fore as we look at whether any kind of segmented response would be appropriate. Balancing that in the other way, there are huge issues of ethics and equity and fairness around treating the population in that different way. So we have to factor all of that in. Now, all I'm really doing in answering that part of your question right now is underlining the complexity of it and the different factors we have to take into account. But I think if we keep in mind, and this is particularly true of the older population who we know are particularly vulnerable, our objective here is to limit the harm of the virus. It's to suppress it as far as possible and save lives. And if we have that as our objective, then some of these decisions will flow from that. But these are the more granular, detailed decisions I hope to be able to set out over the next couple of weeks as our data and modelling and assessment of these options develops. On the second part of your question, look, we all took the best decisions we could for the best reasons as we've gone through this in uncharted territory. We moved, and this was set out in advance, we moved from a contain phase into a delay phase when the assessment was made about the level of community transmission, and therefore we went to a position of seeking to advise symptomatic patients, whether they had been tested positive or not, to stay at home. So these decisions were made on a sound basis. We'll all, when we get to a later stage in this, I'm sure we'll all look back and want to assess what we did, what we didn't do, so that we can learn for the future. But none of us are through this pandemic yet, and I really think for any country, and I don't think you will hear governments anywhere declaring success or victory yet, because all of us know that the decisions that lie ahead of us are as important as the decisions that lie behind us. We are not through this yet, and we've got to continue to make those decisions on the basis of the best scientific advice we can get, but recognising science is not exact. This is also about judgment, and that's what is really important. And in terms of getting a test, trace, isolate approach up to scale, that is a challenge for governments everywhere, but that is a key. If that is a key part of our approach, it's a key part of the challenge we need to address and deliver on as we go through this next phase. And that's why it is so deliberately so central to the paper we've published today. Glenn Campbell from BBC Scotland.
First Minister, how confident are you that people will be prepared to comply with some degree of socially distanced living through the rest of this year and perhaps beyond? And can you or anyone on your team give us a sense of some of the additional public health and other measures that you might need to put in place as you start to ease some of the more restrictive elements of the lockdown policy?
The reference to public health interventions and measures in my remarks today was very much about test, trace, isolate. That's what I'm describing as public health interventions. But you know, there are other things that are perhaps not as central as that. There's an ongoing debate about whether we will advise the public in any circumstances to use face coverings, not medical masks, but face coverings. And we are currently looking at some guidance we want to issue on that. So that may, I don't think we should overstate the impact of that, but things like that will play a part as we start to try to normalise activity, other things that we can continue to do to mitigate the possible consequences of that and reduce transmission. In terms of how confident I am that people will comply, I'm not complacent about any aspect of this, but if you'd asked me a month or so ago if I was confident that people would comply as well as they have with the lockdown, I might have said I hoped so, but inside I'm not sure I would have been as confident. People have complied and responded magnificently in the main. That gets tougher with every day and with every week that passes, and I don't underestimate that. But I believe people want to do the right thing. And I believe that I will be, as First Minister, more able to convince people to do the right thing if I set out openly, clearly, transparently the reasons why we're asking people to do certain things and be honest about the uncertainties and complexities inherent in that. That is why this conversation is so important, because I can't do this on my own. As we make decisions about the best way to continue to contain this virus, the success of those decisions will be dependent on the willingness and the ability of the population to comply with that. So let's have this conversation openly so that we all understand what we're being asked to do, but crucially, why we're being asked to do it and why it's in the best interest of all of us, ourselves, our families and our communities. Ross Govens from STV News.
Yes, First Minister. The leading microbiologist, Professor Hugh Pennington, he suggested some restrictions could be eased on a geographical basis, for example, in more rural communities or in Scotland's islands. Is that under consideration?
Well, if you read the paper, which I appreciate you will not have had a chance to do in detail yet, and I think even if you listen to what I said earlier on, I'm not ruling these things. These are all part of what we have to consider. I guess what I would say about geographic sort of variations, well, firstly, if the evidence says that it helps us deal with the virus, then of course we have to consider that. But one of the things that goes back to Glenn's question, it's about the population complying. I think the other factor in trying to get as high compliance as possible is simplicity of understanding a message. And it stands to reason, if I'm standing here as First Minister on a daily basis saying, if you live in X part of the country, do this, if you live in Y part of the country, do this, I reduce and undermine the simplicity of that message. So these are factors we have to weigh up. These are not binary black and white decisions. They will be balanced judgments where we take all of these things into account. And again, that sort of complexity and that, you know, the grey area of some of these decisions is what we're trying to get people aware of, so that there's an understanding of why we might do certain things and maybe not do other things as we progress through this process. Peter McMahon from ITV Border.
Thank you, First Minister. First Minister, ITV Border today has been speaking to an outdoor activities centre in the southwest of Scotland. Now, if they can't open in the summer, their survival will depend on support from the government. Now, I'm afraid I've not been able to read your document in full because you only published it when you stood up. But it sounds to me, from what you're saying, that there's little chance that businesses like that will open in the summer. So if they can't, what can your government offer them and businesses like them vital tourism industry in the south of Scotland?
Well, as we've said and done from the outset of this, we're asking people, and we will be continuing in all likelihood to ask people to live their lives in unprecedented ways. And therefore the support that government gives to businesses and individuals to help cope with the implications of that equally has to be unprecedented. It is at the moment, through the combination of the UK government and the Scottish government schemes, we are already providing support on a scale that wasn't even seen during the financial crash, and rightly so. That's going to continue, and it's going to have to continue if we are asking businesses to remain closed. So these are all part of the discussions we have to have. Obviously, as I made reference in my opening remarks to discussions we will have to have with the UK government in reserved areas, for example, border control, which is if we're trying to contain the virus in the next phase, that clearly seems to me has to be a part of this, but so too around the economic interventions where these are shared responsibilities. Those discussions with the UK government will be really important. But I absolutely recognise the responsibility for government to help people and businesses deal with the consequences of the actions we're asking them to take. And finally, to remind people, I don't want businesses to have to be closed for any longer than is strictly necessary. I don't want any of these restrictions to be in place any longer than is necessary. But this comes back to a driving health imperative to try to reduce the number of people who lose their lives through this nasty and unpleasant virus. Peter Smith, ITV News.
Yeah, thank you very much, First Minister. Just very quickly, you mentioned about the timeframes and obviously not specific dates, but do you foresee that people would be allowed to see their loved ones and have family gatherings before going to pubs and mass events? And also, I'm just curious, in the document it mentions you are still considering, where appropriate, diverging from the UK strategy, the four-nation strategy, if it would be appropriate for Scotland. You clearly have the powers to do that, but have you discussed how it would be paid for? Because businesses currently apply for things like the job retention scheme directly to the Treasury.
Well, on that last point, I think I made mention of this in response to a question yesterday. These are things that would have to be discussed. I have a responsibility to do everything I can and what I judge to be best in terms of protecting the people of Scotland. But there are levers and powers and access to resources here, but through borrowing powers, for example, that lie out with the Scottish Government. So these discussions are really important. Let me emphasise again, though, I don't come at this from a starting point that says either there has to be a UK-wide approach or there has to be a distinctive Scottish approach. That is not my starting point in this. My only starting point is how do we best tackle this virus, and my decision-making will go from there. And the complexities along the way we will have to discuss and work our way through. In relation to your first point, I'll maybe ask Gregor to say a bit more about just the kind of principles that are set out in here in terms of some of the options we'll be considering, but I'm not yet in a position to stand up and say it will be this restriction that's lifted first on this date. What I'm trying to do is set out what some of those options will be, how we're considering them, and as quickly as possible put much more detail on that. So I hope people understand the context in which we're seeking to kick off this discussion today. Gregor, do you want to say any more?
Yeah, I mean, I know how tough this is for everyone being away from loved ones and being apart and having to try to maintain connections, in particular through kind of new means. I think we've got to be guided by the evidence and the science and what the modelling tells us at all times. And we know that there's certain types of event or gathering that brings households together in closer proximity that might lead to kind of greater spread of the virus. And as I say, as the Scottish Advisory Group, as the UK Advisory Networks work through the modelling that sits behind these, we'll be in a much better and stronger position to be able to give proper advice and safe advice about how we start to kind of remove some of the restrictions that are in place for people just now.
Thank you. Alan Smith from Radio Forth and Clyde.
Good afternoon, First Minister. The key to a lot of this seems to be about this reproduction number and keeping that rate below 1. You've given out what the estimate is at the moment, but I was just wondering if you could detail how exactly is that reproduction rate monitored? How quickly do you get these updates? And if that rate was to go above 1 at any point, if restrictions are eased, how quickly then do you act upon the number going above 1 and reintroducing lockdown measures?
I'm going to hand over to Gregor again in a second to say a bit more about how we monitor that. What I would say from a layperson point of view is that it's not exact. One of the reasons why we can't lift restrictions right now is we're not sure about where that is, and the greater rates of transmission we think are currently the case in care homes, perhaps hospitals as well right now, is a complicating factor in that. But broadly speaking right now, we draw assessments and estimates from the figures that I stand up here every day and report on, the case numbers, what's happening with the percentage of the tests that are positive versus negative, and crucially hospital admissions and ICU admissions. Increasingly, broader surveillance that we're doing in the community will feed into that as well, and that will allow us to assess what that crucial R number is. One of the things that is very clear, and we make this point in the paper, is that partly because of the uncertainty, but partly because of the sensitivity of this, we've only got it down because everybody is living with lockdown right now. So we don't have a lot of room for error in terms of potentially that running out of control again. So that's why we say explicitly in the paper it's not what we want to have to do, but if we start to lift measures and the real life experience shows that that is leading to an increase in transmission, we have to have the option of being able to put those measures in place again, which is why one of the things that will be a factor in our consideration is, what measures are easier to do that with, and perhaps the measures that are easier to put back and quicker to put back may, and it's only may, be the ones that you would perhaps be likely to lift more quickly. But as I say, this is all still work that we are working our way through to get to a much more detailed position. Gregor, do you want to say a bit more about the transmission rate?
So you are absolutely correct to observe that the transmission rate, this R number, is important in all of this, not just in terms of for us to be able to calculate where we are just now in terms of the epidemic, but actually how we start to control and release some of those measures in the future. The truth of the matter is we need data. We continue to need data. We collect data not just to kind of nourish the kind of public thirst for data, but actually because it's really important for us to be able to determine these reproduction rates. And the data that we report to you every day, whether that be the number of new cases, the proportion of cases that are positive, hospital admissions, all these things contribute to our knowledge about where that reproduction rate is sitting just now. At the moment, we've got trend data which shows that it's falling, which is really encouraging, but we don't have sufficient data to be able to tell us that accurate reproduction rate at this moment in time. That will come, but at this moment in time we still need more data over more time.
Thank you. Phil McDonald from Global.
Thanks, First Minister. You said in your opening remarks that events and mass gatherings will be off for some time. I know events like Transmit Festival are still due to go ahead this year, and obviously Scottish football is keen to get back as quickly as possible as well. So what advice would you give to bosses and organisers who maybe aren't sure about what to do next?
We will try to give as much advice and information as soon as we are able to do it firmly to organisers of big events as we can. I know how difficult it is for them, as it's difficult for everybody right now. I suppose what I'm saying today, and I've been very deliberate in the words I've chosen today, because we're not yet at a position of saying, big events will be cancelled until such and such a date. But I'm saying for a period of months in order to try to give as much certainty as I can right now, because looking at everything I look at on a daily basis, I cannot conceive that in the near future we will be going back to having large numbers of people gathering together at large events, given the need to keep some kind of social distancing. And even if that's important in terms of transmission, but it's important for other reasons as well. Compliance. If we're asking people to sit 2 metres apart from somebody in their office, but tell them it's okay to go and stand at a concert really close to somebody, we're undermining and diluting that message. And there's also the fact, which is a point we made at the outset about mass gatherings, every big gathering potentially is a drain on our emergency services. So all of these reasons combine to lead me to say that we're going to not be in a position of mass large gatherings taking place for some months to come. And that's, I hope, not exact, I know it's not exact certainty, but I hope it is some certainty for those who are organising these kinds of events. Katrine Bussey from PA.
Good afternoon, First Minister. Looking at the document today, which talks about the need to establish a new normal, and also sort of listening to your language today, I'm wondering what the prospect is that some form of restrictions could have to be in place, not just for weeks or months, but potentially for years. And if that's the case, how do you think the public will cope with that?
Well, look, I want to try and do two things, and it is in the interest of being as frank and open as possible. I said all along, I'll share what I know, but I'll also be honest about things I don't yet know for sure. So what I don't want to do is give people false expectation that within a very short period of time, things will be restored in normality as we knew it before lockdown. But equally, I don't want to get too far ahead of ourselves either and start to kind of depress people with talk of years. I said today, we have to be prepared for some kind of changes to how we live our lives being with us potentially for the rest of this year, maybe beyond. Obviously, one of the big unknowns in this, which is also, though, a cause for hope, is science, we hope, will help us along the way. And there's so much work around the world going on right now into these things, but if we get treatments that help to alleviate the symptoms, or ultimately we get a vaccine, then that changes things. So there's a lot of uncertainty in this. And so I'm trying to strike a balance between not giving people false hope, but equally not extinguishing it altogether. That there will be ways through this, and we've all already, tough though it is, learned to live in a slightly different way. So as we can ease some of these restrictions and adapt to that new normal, then we'll get used to that in a way. And as we are doing that, hopefully science is helping us out along the way. Simon Johnson from The Telegraph.
Thanks, First Minister. As you say, this document today is to start a conversation with the Scottish people, but it's bound to provoke debate and discussion across the UK, given that you've seen the same scientific advice as the UK government. Should people across the UK be preparing for the possibility laid out in the document today of multiple lockdowns, perhaps imposed at short notice?
Yes, in a word. And I don't think I'm saying anything there that you won't have heard from other parts of the UK as well. I mean, I didn't hear him directly yesterday, and I certainly have no interest in putting words into people's mouths or in case I misquote people, but I was reading some accounts of Chief Medical Officer for England, Chris Whitty, at the UK press briefing yesterday, and it sounded to me as if he was saying pretty much similar stuff to what I've been saying here today. So, we're all looking at this. We're not, and equally what I'm saying, what Chris Whitty was saying yesterday, is not a million miles away from what you will hear other governments in other parts of the world saying too. So this is the reality we face. It's a horrendous reality, not one we want. It's really difficult. The judgments are really difficult. But I think levelling with the public and having the conversation on that basis is going to be much more likely to get us through it than trying to pretend that it is different to what it actually is. Do you want to say any more, Gregor, about the kind of conversations the chief medical officers across the UK have about some of these issues?
So as I said at the beginning, one of the really important features of how we respond to this crisis, this public health crisis, has been how we use the science and the clinical evidence to support the approaches that we're taking. And as I say, it's been very reassuring that throughout this spell, the chief medical officers, the chief scientific officers of each of the countries have remained in very, very close contact with each other. In fact, we speak almost on a nightly basis to make sure that we are maintaining the up-to-date knowledge of where each country is in terms of their own response and the kind of sharing the new knowledge and evidence, which is increasing every day as well. And as I say, I think that will continue throughout this period as well, because it's been one of the very positive things which I think has been established in this, is that these kind of networks for sharing transcend not just the kind of UK nations, but actually internationally, as we all grapple with the same problems and all try to make sure that each of us are equipped with the ability to be able to deal with it in the same way.
Chris Musson from The Sun.
Just following up from what Peter Smith asked, have you or anyone at the Scottish Government spoken to the UK Government about the funding implications of Scotland potentially being locked down for longer or at different times? Put bluntly, would they pay And if you have spoken to them, what did they say?
Look, these kinds of discussions are ongoing, not just with me and the Health Secretary about the health impacts of this through COBRA and other ways, the kind of discussions that Gregor's just spoken about, but many of my ministers are having discussions with their counterparts in the UK government. We're not, I don't know whether lockdown's going to be lifted at a different pace or in a different way to south of the border. As and when we take these decisions, these are issues we have to work our way through when we've got the detail to do that. And I'm not trying, in fact, I'm deliberately trying not to underplay the complexities of this. There are, most of what I'm talking about here today, I will want to do as far as it makes sense on a UK-wide basis, but I have a responsibility as First Minister to use the powers I have in a way that is right for the people of Scotland. Some of this is not within my power. To decide what happens at ports and border control is not within my power, but that's a really important aspect that we will want to have ongoing discussions with the UK government. Similarly, some of the economic interventions. So all of these discussions will require to continue and at points, depending on where we get to in decision making, intensify. There may be challenges and differences of opinion around some of this along the way. That's in the nature of these things, but we all have a duty to try to work our way through that. Vivian,
with respect, you've not actually answered the question there, which is, have you actually had these discussions yet?
It's not a binary. But Chris, with respect, I have answered the question. These things are not binary. We have these the discussions between the Scottish Government, the UK Government. Just this morning, I've had a phone discussion with the other devolved administrations. These discussions are ongoing all of the time, and they will touch on a lot of different issues. The Finance Secretary here talks about the economic interventions all of the time. But we haven't got to a position yet where, it wouldn't be a meaningful discussion for me to phone up the Chancellor and say, hypothetically, if something that we haven't decided yet and therefore don't know the detail of was to happen, what would you do? In a situation like this, in the kind of real world we're dealing in, that's not helpful or meaningful for anybody. So we have to work our way through these things in a proper, orderly way. And this is not meant as a criticism of the media, far from it. I know the job you're trying to do and it is absolutely right and legitimate, but sometimes right now these decisions just don't fit easily into normal news cycles. We have to take them at the right pace and in the right order, and that is what we'll try to do, and we'll try to make sure we're being open and transparent about this as we go along. Vivian Aitken from The Record.
Good afternoon, First Minister. A couple of minor points. First of all, you were talking about the R number, and you said at the moment it was between 0.6 and 1. In your document, it said it had to consistently be below 1. Do we have an actual number for what it should be before these lockdown restrictions can be eased? And also, you said that some of these restrictions could be in place until the end of the year. Does that mean that some of us will not be able to share Christmas with our families? Will Christmas be cancelled as we know it?
No, I'm not cancelling Christmas, okay? We may, and I'm going to be very careful here because, again, a bit like my answer to Chris, and don't read this as irritation or frustration at the media, because it's really not. But I really don't think talking in kind of sound bites, and I'm talking about myself here, not you, about what might happen at Christmas is helpful to anybody. Christmas is still quite a long way away. I know it comes around quicker every year, but it's still quite a long way away. There's a lot of water to go under the bridge before we get there, and Christmas will happen. Yes, it may happen slightly differently depending on where we are here, but we need to take these things in a calm, considered way, and that's what we'll try to do. And I don't think it would serve anybody any good at all right now if I started to speculate about exactly what conditions we'll be celebrating Christmas under. Suffice to say, I'm pretty sure we'll be celebrating Christmas when it comes to it. On the first part of your question, I'll hand over to Gregor. There's no specific figure as far as my advice tells me, but we have to be to get it as low as possible, but also be sure it's that low and be confident that what we are going to do can keep it that low as well. But Gregor, you can probably answer that in a much more expert way than I just have.
So the important thing about the R number is it signifies what level of transmission there may be, particularly in any setting, whether that be the community, whether that be in a care home that's experiencing an outbreak or whatever that might be. And the lower that we can get that suppression, of that transmission is the better, because we stand then the greatest chance of making sure that those low numbers we can identify, that we can track, and that we can trace any contacts with them to make sure that we don't allow any further spread to come from that. So although there's no particular number, certainly the principle of as low as possible is certainly a good one. I don't think that we think it is realistic that we're going to eradicate this virus at all. I don't think that there are any countries in the world who feel that that is a realistic prospect at this point in time. But what we can do by making sure that that reproduction rate or the transmission rate is as low as possible is give us the best possible chance of making sure that we can manage any further transmission and limit that as much as possible for the future.
Dickey from the Financial Times.
Thank you, First Minister. Actually, just follow up on that question on the reproduction rate. I'm struck by the huge range between 0.6 and 1. And 0.6 would suggest fairly rapid progress in reducing the number of cases, and 1 would mean essentially continuing at the current state. Which is more likely as a scenario, and when do you think you'll be able to tell whether the lockdown restrictions have been working?
Again, I'll hand to Gregor, but don't forget that we think that when we started lockdown, that number was more than 3. So if we think it's now at 1 or possibly below that, that is huge progress, and it's only happened because of everything people have been doing. The uncertainty about exactly where that sits is part of why I can't stand up here and say right now we're going to lift X or Y restriction. We need to have much more confidence about that, and we will get that as the days pass, as we get more data. I mean, I can't remember for how many days in a row now, but it's certainly quite a few. I've been able to stand up here and say numbers in intensive care have been reducing. We need a few more days of that. We also need to get more from wider surveillance measures. So our understanding will develop all of the time, and we need to make judgments about when it has got to a stage where we can start to do things as opposed to talk to you about the kind of options that we are assessing. Gregor.
The reason the R number was above 3 when we started this is because this is a wholly new virus that we just don't have any immunity to. So it allows it to spread really without any restraint across our communities. So in this short period to be down and now actually saying that it's probably between 0.6 and 1, I think is quite remarkable. And as I say, I think that's a testament to what the Scottish public have contributed in the response to this. But the simple truth is, as yet, we do not have sufficient data over sufficient period of time to be able to say with accuracy exactly where that reproduction number is just now. Now that, as I said, will come, but at the moment I don't think it's helpful to speculate exactly whether we're closer to 0.6 or 1 at this moment in time, because it would be pure speculation.
Judah Davison from the Scotsman.
Thanks, First Minister. In your document today, you mentioned border controls and the health surveillance of people coming into the UK. We know that hundreds of thousands are still arriving from coronavirus-infected countries and they're not being tested. How effective can a test, trace, isolate procedure actually be if people are not being tested as they arrive in the country? And are you putting pressure on the UK government to change that?
Well, I think, as I've said a couple of times now, I do think this is one of the issues that as part of where we go in the next phase of this has to be a key consideration. I've spoken before about the limitations of testing, which is not to say testing is not really important, but that testing when people are not symptomatic is not as reliable as you would ideally want it to be. So there are limitations. Similarly with temperature checks. Temperature checks will often give you false positives or false negatives. So none of these are absolute, scalpel-like instruments. But as we go into another phase, then the balance of judgment around these, I think, potentially becomes different, and they have to be considered afresh. And that's why we will continue to discuss that with the UK government. Do you want to add anything about some of these measures?
I'll go back to the point about learning from the experience of other countries, and we know that those other countries who've been able to suppress the transmission within their communities and then started to reopen up and to kind of gradually ease the measures. One of the really important points of introduction of new infection has been through international travel, and particularly returning population to those countries. And as I say, my own view is that we need to learn from that and learn from that very carefully to make sure that we've got an approach in this country that actually begins to kind of reduce the risk of that happening here.
Andrew Learmonth from the National. Andrew?
Hello,
Hi.
sorry. I think a lot of parents watching will want to know a bit more about how schools could reopen. You talked about redesigning classrooms and said that maybe not all children can go back to school at the same time. Are you able to say a little more about what discussions you're having, what a redesigned classroom might look like, and does that mean we could even see kids back in school before the summer?
I'm not able to give too much more information about this right now because, as I've said repeatedly, these discussions and considerations are still at a very early stage and have to be informed by the data and the evidence. So what I'm about to say, please don't take it as this is a definite indication of what we're going to do. You know, when I talk about redesigning classrooms, that's maybe a grand way for talking having desks further apart from each other. So, you know, I think some countries have perhaps had some children in a school going back. There has been some talk, and it's certainly an option that has to be considered, although we might not do it, of, you know, some kids go 1 week, other kids go the next week, so that there's, you know, the ability to have smaller classes. Now, these are all just ways of illustrating that this is not binary. Just as it's not a flick a switch and the lockdown ends, it's not schools are closed one day and open as normal the next day. There will be potentially an area in between where schools are not exactly closed, but they're not open as normal either. And these are the kind of options that we're dealing with. I know parents want to know more. I want to be able to tell parents more as soon as possible, and we will do that. And on the summer holiday point, you know, what I've said before remains the case. We can't guarantee schools will be back before the summer, but if they can be in any way, we would want that to happen, because we don't want children to be out of school for any longer than necessary. So, you know, I keep coming back to the obvious point, these are really difficult judgments, but if we get these judgments wrong, then the impact on the virus will be really damaging. So we have to try and get them as right as possible, and if that means taking a bit more time to consider them, then I think that is worth doing. Rachel Watson from the Daily Mail.
The former Chief Medical Officer previously gave an update of how many people in Scotland she believed had been infected by coronavirus. As of March 27th, she said it was 65,000 people. I wondered if you've spoken about the reproduction rate of the virus today, and I wondered if you could give us an update on what you believe the number of people who've been infected by the virus are and how you get to that number.
I'm not going to give precise numbers today. What Dr. Calderwood said at the time, and was rightly doing so, and I think it was based on what others across the UK were saying was an assumption about if you draw from the number of deaths and the number of people in intensive care, what that signified in terms of the potential number of cases that lay underneath that, and extrapolating from that. And you know, but as we go along and get more data, not just here in Scotland, but as studies and you know, exploration internationally allows us to draw greater conclusions about the percentage of the population that might have had the virus, then clearly we can replace some of those extrapolations with actual data. But we're not in that position yet, and that is the point that is central to so much of what I'm saying today. Tom Martin from the Daily Express.
Hi, good afternoon, First Minister. Obviously, contact tracing will play a key part in the sort of future strategy that's been outlined today. I just wondered if briefly, firstly, if the CMO could just explain who's responsible for that at the moment, how that works, and how we go about ramping it up to what the kind of level we might need for bigger sort of surveillance of the disease. I mean, are we looking at an example for recruiting volunteers from elsewhere, redeploying other kinds of staff?
Well, I said a few questions ago that this work of working out, you know, how many people would potentially have to be tested, what that would mean in terms of contacts and contact tracers, that work is underway, not yet got to a conclusion. But Gregor, do you want to say more about the assessments that are being done as part of that?
Yes, so we've got a national organisation, Public Health Scotland, whose responsibility is to kind of lead the response, the public health response in Scotland, and they are currently looking at work alongside others to look to see exactly what a model of delivery would be for contact tracing at that level of scale. And I think given the scale that is involved, it's very likely that that workforce would need to be augmented from other areas. Now, that could come from a variety of different areas and could be done fairly straightforward and in a simple way with some basic retraining. But with the likelihood of the type of numbers that we would wanting to be contacting and tracing in this country, I think that would need some further development of that workforce to enable that to do so.
Secretary, do you want to add?
I'd just add that there are broadly 3 strands to how we are ramping up to be ready to do test, trace and isolate to the scale that is needed, bearing in mind that we are still looking for the data to finally tell us what that scale might be. But one of those strands is not only about our testing capacity, it is also, as the CMO has just said, about who would undertake that tracing. And one of the areas that we are looking at is we have to balance what our National Health Service still needs in terms of its expert staff. But alongside that, we shouldn't forget that we now have 21,000 individuals who have registered with us, either as retired health and social care professionals, but also medic students, student nurses, student midwives, allied health professionals, all of whom have clinical skills. We are currently deploying them into our health boards and into social care, but we may well have capacity there to augment in a clinical way. People need to be trained, they need to know what they're doing, but in a clinical way to assist with that contact tracing and the follow-on advice that's then given to people. And the third area is to look at the extent to which digital technology can assist us in this. We haven't reached conclusions on any of those things. As we do so, we will, of course, make sure that people know what decisions and conclusions we're reaching. But that, I hope, gives a broad idea of the scale of the work that is now underway.
Okay, thank you. Kieran Andrews from The Times.
Thank you, First Minister. Test, trace and isolate is at the centre of this extent of lockdown, but on the 15th of March, the Scottish Government scaled back who it was testing from everyone who had symptoms in the community to just frontline health and social care workers. Could you please tell us why that decision was made? Was it purely scientific advice, or was it partly because of a lack of capacity to carry out the necessary tests?
I think I told you that at the time, and I have repeated it many times since. We moved from from contain phase into delay at a time when we judged community transmission was underway within the country, and over that period, advice changed to people that told people with symptoms to stay at home and isolate themselves. So the testing wouldn't have changed what we were asking people who had the virus to do. We then used the capacity of testing we had at that time on the 3 objectives that we set out very clearly, which was to make sure people with serious illness going into hospital were tested, the key workers, we would start to focus on key workers, and thirdly, the strand that was about surveillance testing. We've since, in recent days, as our capacity builds, expanded some of those categories. For example, the first one, we now are testing more in care homes, and we will continue to expand those categories as the capacity builds. But the decision in March was based on that. If you recall, I can't remember the date off the top of my head, when we published the 4 Nations Action Plan and those 4 phases of contain, delay, response and mitigate. That was about the shift from contain to delay. I've got Derek Healy from DC Thomson.
Thank you, First Minister. Figures published by the Scottish Government yesterday show that Dundee has the highest rate of confirmed COVID-19 cases per head of population in Scotland. NHS Tayside told us that this is because they implemented a robust testing system on the 17th of March, and as a result have tested, in the words of a senior doctor, many more staff and frontline workers than other health boards. They say this means essential staff who test negative are able to return to work more quickly. If NHS Tayside knew this was the right action to take so early on, why is it taking other health boards and the Scottish Government so long to catch up? And will you commit today to regularly publishing test figures broken down by health board so the public can know the right actions are being taken in their area?
Well, as you know, we're publishing more and more information. We publish the number of tests we do. I've been able to give figures of key workers testing, so as we can, we will publish more detailed breakdowns of all of that information. All health boards are working to and are increasing testing of key workers, but I would absolutely say NHS Tayside has been an exemplar in this, and other health boards have been able to learn from the methods that they have been using. So I would absolutely give them the credit that they deserve, and the Health Secretary may want to say a word or two more about the ways in which other health boards have been seeking to learn from that.
So when we started out in the very early days, we had 2 labs, NHS labs, testing 350 cases a day. We will very shortly, in fact, from memory, but I'll correct this if I'm wrong, by the end of this week, have testing capacity in every single health board across Scotland. That is part of our increase in testing capacity. The individuals through our National Labs programme are in constant contact with each other and are indeed learning the lessons that NHS Tayside are able to point to about the methodology that they've used in order to produce those good results. And other health boards are now beginning to apply those so that we can see an increase in the use of the capacity we currently have, bearing in mind that we are increasing that capacity. We will meet our deadline or our target of 3,500 by the end of this month. I'm confident about that, hopeful that we will be able to go further as we continue to increase the capacity. Right now, the importance is about using that capacity to maximum effect as we are in this lockdown period and preparing the testing infrastructure, if you like, in the ways that we've talked about earlier in this briefing, so that we are ready to be part of moving through the next phase as decisions are considered about which and at what pace various restrictions in lockdown could be eased.
Thank you. Tom Peterkin from the P&J.
Good afternoon, First Minister. Your document talks about innovative approaches to physical social distancing. I'm wondering what that might involve other than, remote working or video conferencing. And are we at the stage, just picking up from something you mentioned in your answer to Glenn Campbell, are we at the stage where the public are going to be advised to wear masks if they go out?
So the innovative approaches are broadly the kind of things that you have been talking about, and we've all been finding innovative ways to keep in touch, to do our jobs while not being in physical contact with each other. Some of the other things that we've already spoken about today in terms of how we redesign workplaces and potentially school classrooms to allow people to get back to normal, but in a way that allows social distancing to be respected. So these are all the kind of things that will undoubtedly and inevitably be part of this mix going forward. The masks point, yes, I think it is likely that in very limited circumstances we may advise people to use face coverings, and I keep saying face coverings, not face masks, because this is not about medical masks. It's about, a scarf or bandana to cover your face. But the reason we're taking some care about this and being informed by the science is that we don't want to overstate the impact that can have, nor do we want to give people a sense that as long as they're covering their face, it's okay to do normal things without social distancing. So there's a bit of care being taken by all governments across the UK, but we will be looking to issue some guidance on that over the next few days. Libby Brooks from The Guardian.
First Minister, the document says that you want to consider how well new measures can be communicated and understood by different groups and how likely they'll be complied with. Do you have concerns about understanding and compliance with particular groups? And can I just ask a heeding question of Gregor Smith? You were talking about the R number. You said in principle you wanted it as low as possible, but did you give an exact figure that you were aiming to stabilise it at? Thank you.
Did you?
So, no, I didn't give an exact figure. I just want to see it as low as possible.
Yeah. I thought that. I was about to say if he gave you an exact figure, it's not one that he had given me previously. So I'm glad we're all on the same page. On the first part of your question, I don't have particular concerns about particular groups in the population now. I think by and large the compliance with these measures has been absolutely magnificent, particularly given how severe they are. But the point I'm making in future is if we were to go from where we are just now into a message that was tailored differently to different parts of the population, then clearly, not because people don't want to comply, but the ability of people to just understand properly what we're asking them to do will become more complicated. And that is part of what we have to think about as we decide what we're going to do and what we're not going to do. So that's why it's mentioned as a key part of the considerations that we'll have going forward. Alistair Grant from the Herald.
Hi there, thanks very much. Just to follow on from the comments made earlier about the prospect of people seeing their friends and wider family, I think a relaxing of coronavirus lockdown restrictions is reportedly being discussed in Belgium, which would see gatherings of up to 10 people allowed on weekends. But the only catch, for want of a better word, would be there'd have to be the same group of people every week. Could something like that, allowing people to see their friends but having to be the same group each time, be under consideration as part of these measures?
Again, with the obvious caveat is that please don't take this as something we have decided yet. All of these kind of things are under consideration. How, if I can summarise it by saying, how do we get as much normal life back while still stopping this virus running out of control? So all of these different ways in which we might be able to get a semblance of normality are under consideration. I don't know, I will only speculate as to whether people would be keen in a situation where you could only see the same friends week in and week out, but it may be better than not being able to see friends physically at all just now. So this is about trying to strike the right balance. How do we get some of what we all value and love and cherish in our lives back while putting ourselves and our families and communities at risk? So in short, all of these kind of things, and we said earlier on, we are learning from other countries, so we'll be looking carefully not just at what other countries are doing, but what impact they have or don't have, and trying to find the best balance. As I say, I can't say categorically right now where we will end up in all of these things. There may be things we have to test cautiously and carefully before we can take bigger steps. But that question from Alistair was the last question, which allows me to really round off by saying again that today's publication and the focus of our briefing today has really been to try to open up some of this discussion about the options and the factors that we have to take into account and the risks and uncertainties and complexities of all of that. It would be much easier and much more natural territory for a politician to stand up in here and say, I am today announcing that we are doing X, Y, Z. That's how we normally do things, but that's not appropriate right now. Of course, we get to a point of taking firm decisions, but the way in which we get there involves all of us thinking carefully about how we live our lives and how we might have to live our lives for quite some time to come. So let me end by thanking Jean and Gregor and our signer again today, but thanking all of you for joining us today. I would repeat again, please, I know most of you probably have never felt the urge to go onto the Scottish Government website and read a government publication before, but please take the time to do this if you can. And if you have views on what we've set out today, then let us know, because we're all part of this. It is about all of our lives, and we need to try to come to these decisions in as open and inclusive a way as possible. So thank you very much for your patience in listening today, and we will see you here at the same time of 12:30 tomorrow. Thank you.